All right, good afternoon, everybody. Thank you for joining us. My name is Renee Jensen, and I am the CEO here at Snoqualmie Valley Health. We are very excited to bring to you our very first virtual candidates forum and give you an opportunity to meet our candidates. We are your public hospital district, and this is a very important position for our healthcare system. Our commissioners are elected for 6-year terms, and it's very important that we have great leaders in our community helping us on our board and leading our healthcare choices. So we are going to get started. I'm going to tell you a little bit of the ground rules just so that everybody knows what to expect. We will be sharing and providing a link to this recording to each of our candidates so that they are able to use it on their social media pages or to share with their friends and family. We will also be distributing this through the healthcare system's social channels as well. Each candidate will be given 2 minutes to answer each question. There will be a 20-second warning that will appear on the screen when you have 20 seconds remaining. Once your time is up, there'll be another banner that lets you know that your time is up, and we ask that you wrap up and close your comments at that time. We will make sure that every candidate gets to answer every question, so each of you have an equal opportunity. We will rotate through the order so every person gets the chance to go first. And with that, if there aren't any questions, we can get started. Are there any questions from our candidates? Okay, gentlemen, we will get started. Our first question, we will start with Gary, and we would like you to tell us a little bit about yourself and why you're running for a seat on the board.
Okay, I am a graduate traffic and transportation engineer. I have 50 years experience in that role in the Puget Sound region, and I've worked in that role across the country. I am particularly interested in this hospital district as we have been involved in that for over 50 years for the time that we've lived in the Valley. And we've seen it go through many iterations of progress and growth and development. And I'm really excited to see this hospital continue on the pattern that it's going right now with really well laid out plans for growing the hospital and giving it a secure future. Because I really believe that's what we need to be working for, is establishing a secure future for the district so that it'll be viable not only today, but in the 10, 20-year future.
Great, thank you, Gary. Robert, would you like to go next?
Sure. My main goal as commissioner will be to ensure our hospital district is evolving and changing to meet the needs of the growing community. Our community is both growing and aging, with 25% of the residents under the age of 17, but have a relatively flat growth curve, while the 65-year-old and older population has nearly doubled since 2010 and is projected to grow an additional 40% by 2031. We must increase the number of providers, specialty services, outpatient surgery services, rehab services, diagnostic imaging services, and put clinics in the area of the population growth to provide better access to healthcare to meet this changing demographic. A perfect example of this is the construction of the new primary care clinic in North Bend, an area that is very much in need of local medical services. In addition, we just broke ground on a new 85,000 square foot ambulatory center adjacent to the hospital to be completed around the fall of 2026. The new facility will provide additional primary and specialty care doctors, an outpatient surgical center, and address other service shortages in our area. As commissioner, I will continue to ensure that we stay focused on increasing the medical services in our community.
Thank you, Robert. And Mark, would you like to go last?
Sure. I'm a lifelong resident of Washington State, graduated from Anacortes High School a long time ago, then went on to graduate from the University of Washington Physician Assistant Program. My goal is to continue, as my fellow candidates have said, with the growth that we're experiencing with Snoqualmie Valley Health. We have a really dynamic constituency that we serve, and we're going to have to continue to grow and be flexible. I think as we do that, I will be able to add some strong leadership and a long history of healthcare experience. My hope is that we continue into the future and grow and serve our community even better.
Great, thank you, Mark. It's nice to meet all of you, and I appreciate your willingness to serve on our board. Thank you for your commitment to your community. All right, next question. Robert, will ask you to go first this time. What experience or qualifications make you uniquely suited for this position?
Okay. Well, as I previously stated, the residents in our district need additional services to meet the increasing population and demographics of that population. To ensure our expansion goals are met, we must be sure our hospital operates in a fiscally responsible way, providing the revenue needed to deliver the new services and building of new facilities. Hospital revenue is limited by Medicare, Medicaid, and private insurance reimbursement rates, which barely cover the cost. Managing hospital expenses and increasing the number of patients we see is the only way to create revenue to fund additional services and expansion. In addition, the medical knowledge of a commissioner needs to have the medical knowledge is something you really need to have as a commissioner, in addition to a deep background in business to ensure we meet these goals. My business background includes over 30 years of executive roles including managing a billion-dollar division of a large corporation, building a company from startup and taking it public, 17 years as a fire commissioner, assuring compliance with many of the same regulations as the hospital district. For several years, I've been involved in the Snoqualmie Valley Health Organization, including 2 years on the Finance Committee. So I'm very familiar with the financial goals, objectives, and challenges of the hospital. In addition to my business background, for 35 years, I've been a volunteer firefighter EMT and have worked for the last 10 years in a hospital ER and cardiac unit, all of which I'm still actively involved in today. My work on the Finance Committee, combined with my business and medical knowledge, provide me with a unique ability to guide the hospital into the future and ensure its financial success.
Thank you, Robert. Mark, would you like to go next?
Sure. My belief is that a position as a commissioner does definitely require a fiscal background. However, I think the core of what we do is based on medical care and access to it. The experience that I have as a University of Washington graduate of physician assistant program and later a master's degree at the University of Washington in physician assistant health services, in addition to my 22 years as a naval medical officer, 6 years as a commissioner for the city of Issaquah's Policy Planning Commission and Development Commission. And I've also performed led three medical missions to Haiti and to Uganda. Addition to that, I have been married to my wife Tacey for 41 years, and my daughter Amanda is a Division I athlete, graduated from the University of Hawaii. So I got to know a lot about sports injuries in that realm. Additionally, I'm a gymnastics coach and an avid sports enthusiast, and I think that is an area where we can grow. I think my vision, my experience, and my dedication will be very helpful as a commissioner.
Thank you, Mark. All right, Gary, you're up next.
Thank you. Having been a 51-year resident of the Snoqualmie Valley and having observed the growth and development of the hospital district, the changes that have taken place, and the need for having the community involved in the hospital and be served by the hospital. I think that there have been some great improvements made in that arena over the last 10 years. Before that, it was very problematic. There were even major portions of the district that were threatening to withdraw from the district because they weren't receiving quality care or even any services that were viable for them. So I've really taken a strong interest in helping to push the hospital to serve the local community in a more effective way. I was asking people here just recently, this last week, long-term people living in Fall City, if they use the hospital. It says, no, they don't. They go over to Bellevue and Seattle for their services. And I think we've got to change that. And that, I think, comes through the offerings of the hospital. I had the opportunity to use the physical therapy facilities and talk to those people, and was very positively impressed with what they were able to do for me, which other service providers were not able to do for me. And they had some pretty extensive plans in order to engender and provide the service to the community as a whole. And so that's what my goal is, really to get the community engaged in supporting the hospital.
Great. Thank you, Gary. All right, Mark, you get to go first this time. And our next question is, SVH has recently undergone a rebrand. How do you align with those core values, and how do you plan to support the mission, vision, and values of the organization going forward? And Mark, you're up. That question's for you first this time.
I believe that the consensus begins with a common goal. And the common goal, I believe, that we all share here is that we want to extend and improve services to our community. We have a large constituency, and it's quite diverse. So we have to be nimble. As, in terms of collaborative working together, that common goal is important. We will bring our various views to the table. However, we have to keep our eye on the ball and keep our eye on the common goal and work toward it.
All right. Thank you very much. And Gary, you're up next.
So I think a successful board of commissioners is ones that can agree on the goals of the board and the hospital district, and support one another in ways to improve the hospital offerings and the service and the provision of the resources that are necessary to keep the hospital operating. And I think that's a very important factor for people to be able to put aside their very specific plans and ideas for the hospital and learn how we can work together to be more effective as a group, and be able to offer that service to our constituents.
All right. Thank you, Gary. Robert, would you like to take a chance at answering this question number 3?
Okay. I've had the honor of serving our local community for over 10 years as a member of the Snoqualmie Fire Department. As such, I have witnessed and been a part not only of the rebranding, but the reinventing of the Snoqualmie Valley Health, which started really in November of 2020 when Renee was hired as the CEO. Through my multi-year association with Snoqualmie Valley Health, I've been a cheerleader for the community, telling everyone I meet that this is a new and exciting healthcare organization. I have worked hard to reestablish and build trust in the new organization among my firefighting colleagues and patients who I come in contact with. I'm 100% in support of the core values of the organization, and have written articles about the changes, spoken at events about these changes, and continue to promote and very excited about the future that we hold for the hospital and the community.
Thank you, Robert. All right, gentlemen, we will move on to question number 4. And Gary, you get to go first this time. Describe the value you see in having a public hospital district in Snoqualmie Valley.
Well, for me personally, I have had many opportunities to use the hospital for the emergency room services, the physical therapy services, all have been a strong benefit for me personally. Beyond that, my wife and I raised our children in the Snoqualmie Valley. and we had 8 children, and we had many opportunities to come to the hospital to have bones fixed. My son broke his foot. He had surgery here. I had to have stitches given to our kids. So the close proximity of the hospital and the services that it offered have been a very strong benefit to our family. Now, I realize there's things that the hospital hasn't been able to do, somewhat by the limitations of the category that they're placed in as a swing bed hospital, and a limit of the services that are provided under that provision. But I think there's a lot of opportunity to pursue additional services that are going to meet the needs of this community and fulfill their expectations. I think there's a lot of people out there that can benefit from the hospital if they're aware of what the hospital offers. So I think part of our goal as commissioner on the district is to spread the word to people and encourage them to use the hospital and be strong advocates for the services that are offered.
All right, thank you, Gary. Okay, Robert, you are up next. Describe the value you see in having a public hospital district in Snoqualmie Valley.
Well, I could spend all afternoon answering this question. However, I'll limit my answers to three areas: capacity, specialty services, and accessibility of healthcare. Whether your doctors are at Swedish in Issaquah, Overlake, or downtown Seattle, Snoqualmie Valley Health benefits you in several ways. We have all experienced the frustration of getting a timely appointment with our primary care provider. 6 to 10 weeks seems to be the norm. As the population on the east side continues to grow, more and more demand is put on a limited number of primary care providers and even a smaller group of specialty care providers. This demand drives up the waiting times in getting an appointment with a doctor. One of the greatest benefits of the growth of Snoqualmie Valley Health is adding to the capacity of providers in the healthcare system. Increased capacity is the only way to reduce waiting times. Again, even if your doctors are not at Snoqualmie Valley Health, this will relieve some of the demand on your doctors by allowing others to use new providers. The other benefit is the locality of the healthcare services. The new clinic in North Bend will provide much needed services to the east part of the district, eliminating the need to drive to Issaquah, Bellevue, Seattle, or other areas. In addition, by the fall of 2026, we will have even more capacity with the opening of the new medical building next to the hospital. This will also provide new outpatient surgery services. So to summarize, I think the greatest value I see in having Snoqualmie Valley Health in the valley is the greater accessibility to needed healthcare services and an increase in medical providers.
All right, Robert, thank you. Okay, Mike, you're up.
In an earlier meeting, I heard candidate Gary say that we must remain an independent public health district. And I hope that I'm not misquoting you on that, Gary, but I certainly agree with that concept. For us to remain independent, we are able to make decisions that meet the needs of our individual constituency as they determine it, as opposed to alliances which have their own business interests amongst one another and sometimes compete with the same constituency. So I think it's very important that we remain a public health district. If we're to achieve the outcomes that our constituencies desire, I think we need to be independent.
Great. Thank you, Mark. All right. For our next question, what excites you about the future of the healthcare district? And if elected, how do you plan to support that? And I believe that, Robert, you're up first.
Okay. What excites me, I think we have unmatched quality healthcare in our neighborhood. We're consistently growing and evolving to meet the needs of the community, whether that be emergency services, urgent care, primary care, specialty care, the rehab services, the coming outpatient surgery, etc. But Snoqualmie Valley Health is evolving into more than just a healthcare service provider. It's evolving into a community center providing education, a community meeting place, recreation with a new rock climbing wall in the new facility, and also a top-rated chef preparing meals in a new restaurant, and much more. It's truly evolving into a health center, which will benefit the community. I don't know of any other hospital with goals and visions like those of Snoqualmie Valley Health. I'm very excited for our future and hope I can continue to be a part of that.
Thank you, Robert. All right, Mark, you're up next.
Previous meeting with the candidates and with the CEO and staff, I was excited I mentioned that I was very proud of the pioneer spirit that Snoqualmie Valley Hospital or Health Center has exhibited since its institution. My feeling about, or where I'm excited is, I agree with Roger on this in that I love the expansion into North Bend, but my desire would be, if it's desired by the various communities, that we expand into the other cities, Falls City, Maple Valley, Carnation, Duval. In terms of working with the district, or in terms of working with the health center, I believe it's really important that we as commissioners either avail ourselves to the services so that we can speak about them personally. And I think we need to be the biggest advocates there are in terms of encouraging people to use our facilities so that we can expand.
All right, thank you, Mark. Okay, Gary, you get the last shot at this question. What excites you about the future of the healthcare district, and how do you plan to support it if elected?
What excites me about it is what I've observed taking place in the last 10 to 12 years in the district, from where it was then with the issues that surrounded the hospital district then, which were some pretty significant things that were challenging the longevity of the hospital. And the district has been able to overcome those and grow. And today we're far ahead of where we were then. And that excites me that the board and the district has been able to work together on a plan that is moving this hospital forward to offer these services that I've benefited from and my family's benefited from. And I think it's a very necessary and exciting thing to have this facility in our community to offer these services to the people that live here in this valley.
Okay, thank you, Gary. All right, gentlemen, we've got 2 questions left. The next one, Mark, you get to go first. And I would like to know which one of our core values you feel resonates with you the most, and why is that important for your role on the board?
With my background, I'm obviously a passionate person about quality healthcare that's affordable and accessible to all citizens. I don't think that I agree with the mission statement of including all persons and serving them with dignity, with quality, and with respect.
All right. Gary, would you like to go next?
Yes. I think one of the things that is most important to me is the recognition of the employees that you have here, because they are the ones that are providing the service. And I know that historically, we lost a lot of good service providers because they weren't happy with the way things were going, and that changed the whole quality of the offering of the district. So I think your discussion you shared with us last week, Renee, really resonated with me, that to provide benefits and pay that encourages the employees and keeps a positive environment for which they're working in. And I would be a part of my role on the board would be able to support that and use that as a tool to encourage the community to use this hospital through the quality services that we provide.
All right. Thank you, Gary. And Robert.
Okay, so as far as the core values, I'm very much in agreement with them. I think to me, the one I've personally been working on the most is the building of trust, or in this case, the rebuilding of trust with the rebranding and the reinventing of the hospital. That's one that I've spent a lot of time trying to convince people in the community, this is a new hospital. You really have to give it a try. And when they do, the reaction is very positive. People hadn't realized how much it's changed and the services that are offered. But more importantly, the comment that comes back to me over and over again is, I got right in. I got right in and I was taken care of right away instead of having to wait weeks to go see my, other doctor somewhere else. The other thing that I think that is really exceptional about this hospital is the obsession over excellence. I mean, that's a core value that people talk about, but it really is practiced. And my wife had to stay there at the hospital for a while, and I was so impressed with the level of expertise, caring, just the whole staff, even the night shift, which I'm in the hospital industry, and I understand how challenging it is to get good help at night. The help at night was excellent at the hospital. And so I really do think that speaks to the excellence. And then, lead innovation. We talk about that value. We look at what you're doing with the new facility, the new health facility next to the hospital there. That's leading edge thinking that I don't see anywhere else in any other hospital system. And of course, the deep connection with the community, that the services that you're going to be offering there in that center, it really does put you in closer contact with the community, which is really outstanding.
Great. Thank you, Robert. All right, let's get down to our last question. And Gary, we will let you go first this time. Can you please explain to us why you think you are the best candidate for this position?
I have thought about that quite a bit. I recognize the quality of the other candidates, and I appreciate their willingness to pursue a position on the board. And I would not be amiss if somebody else got this because of the quality of the other candidates. I think the one thing, though, that I really is my focus is the community as a whole. Like I said, I've lived here for 51 years. I've established a lot of relationships with people in the community, and I know what their attitudes have been about the hospital, and I want to see that turn around, and I would work aggressively to do that and trying to increase the participation in the local community in the hospital district. So that is really my focus and what I would hope to be able to work to the benefit of the hospital.
Great. Thank you, Gary. All right, Robert, same question for you. What makes you the best candidate for this position?
Well, I think there's several aspects that make me a very viable candidate for this position, and I think the community is very fortunate to have two other good candidates as well. I think the thing that would possibly make me stand out in people's minds is not only the medical background, but the strong business background and understanding how to really keep the hospital financially on track so that we can provide the services that we all want in our community. And being in the community on a daily basis, servicing the community from an emergency standpoint, emergency responder standpoint, I have the opportunity to really talk to patients one-on-one. And given it's sometimes the worst day of their life that I'm seeing them, but we have the ability to have these extended conversations while we're caring for them and understand more about their medical challenges and the needs, and more specifically, what's not being serviced, in their opinion, in the area. And that gives me a perspective to bring back to the board and say, this is what I've heard, this is what I think we need to work on. And if I start hearing that from multiple different patients, then that becomes a pattern that I think is very important to share with everybody. So I think that being in the community on a regular basis, having that medical background, but again, having that strong financial background and knowing how to keep a hospital healthy financially so we can continue to grow and expand and provide the level of service our community is asking for. I think that's one of my real strengths.
Thank you, Robert. Okay, Mark, you're up. You get to tell us why you think you would be the best candidate for this position.
What I find myself, or I consider myself to be uniquely qualified for, is my depth of knowledge of the medical realm, the world. And I'm one of those that has had the unfortunate task of telling people very bad news in very difficult situations, in finding a way to maybe not assuage the discomfort that they have or the pain that they have, but to help them move through the steps in terms of care and recovery and healing. Um, I think my medical background gives me a very unique standing in that regard. I've actually touched the patient. I've been in the operating room. I've had my hands on a human heart, and that impact on you when you're very young. Um, I guess all of that's to say that I'm a very passionate healthcare provider. And it is my passion that we continue in this community to provide quality healthcare that's affordable and that people can rely on, and that they feel that they're treated with dignity and respect, no matter how they come in the door. Um, so I think the quality that I've had, the universal healthcare experiences that I've had in a variety of different venues will help me to understand what the practitioners are saying, what the executives and staff are saying, and what the patients are saying, more importantly. If we're serving our patients, we're serving the community. And I feel very strongly about that. And I think it's a very important role for the commissioners.
All right, thank you, Mark. Well, gentlemen, thank you very much for taking the time today to participate in our virtual candidate forum. And I hope this is helpful for our community to get to know a little bit more about each of you as they're making a very big decision and choosing who will serve in this vacancy for the next 6 years. So I wish you all the best of luck and thank you very much.